Okay, hello everyone, and welcome to this webinar, Commercial Baby Foods in Crisis, Addressing Health, Marketing and Inequality. I'm Barbara Crowther. I'm the Children's Food Campaign Manager at Sustain, which is the Alliance for Food and Farming. A little bit about us. We bring together over 100 campaign for policy changes in schools, communities and throughout society so that all children can easily eat sustainable and healthy food. And ensuring that children have access to balanced and nutritious meals is a daily challenge faced by millions. And it ought to be straightforward for children to eat healthily. But our evidence shows that many parents feel various external factors are making this task unnecessarily difficult. So we're really excited to be hosting this webinar today in partnership with the University of Leeds. We'd also like to thank Which as the funders of the research that you're going to hear presented today, and also to Impact on Urban Health, who have supported the costs of the Children's Food Campaign, our Parent Ambassador panel, and the parent polling that went into this research, as well as our ability to co-host this event. We have had a phenomenal response to this event. So, you know, we've had over 750 people register to either receive the recording or be here online. So we're really glad to have you all with us this morning. And it shows the huge upsurge of interest there is in this topic. However, before we get into the content, just a few general housekeeping rules. Today's webinar is being recorded, including the sound and the slides. We're going to share that with you after the webinar. It'll only be the speakers and panelists' videos and the presentation that will feature. Nothing in the chat will be published. The chat is currently open. If you want to introduce yourself in the chat, say where you're joining from and any interest you have in the discussion, you can do that now. However, we are going to close that in about 4 or 5 minutes. So please do introduce yourselves now in the chat. You can also make use of the CC button at the bottom of this screen if you wish to use captions for this event. However, what we are doing is closing the chat during the main presentations and the panel debate so that it doesn't distract or confuse anyone. We will post links to relevant documents being mentioned, and we will turn the chat on for the final 5 minutes for you to add in any comments that you wish to make at the end. We do, however, encourage you to ask your questions throughout this webinar. So there is a button at the bottom of your screen called Q&A, and that allows you to ask questions to the panel for the webinar. Please use this for all your questions. You'll be able to see other questions people are asking. You can also vote for questions that you would like to see answers, and that will boost them so that we can prioritize the ones that people most want to see answered. We will also try and respond to any factual questions or clarifications in writing in that Q&A box, as well as we'll take some live questions during our discussion section. So please do try, keep your questions brief and to the point, and do indicate if you are wanting to ask a specific panelist a question, so put their name in as well. So just want to take a moment to remind you, we're a very diverse and inclusive community. We don't tolerate any form of discrimination. We know that children's health and healthy eating can be sensitive subjects. People, including parents and children themselves, sometimes feel judged, stigmatized or blamed by the media and others. So please do bear this in mind in any questions that you ask. So we want to have an event where everybody feels safe and everyone feels respected. If you do see or notice any issues or have any issues, please do not hesitate to get in touch with us at Sustain. Finally, if you are using social media, we'd love you to share your thoughts. Use the hashtag #KidsAreSweetEnough, all one word. You can tag us on Instagram at Children's Food Campaign at University of Leeds. And you can also tag all panelists by their individual names or at Sustain's LinkedIn page, but all panelists are on LinkedIn if you want to tag us all on there. So that's it for the housekeeping. On with the show, as they say. Let's start by just finding out a little bit so that you know and we know who's in the room today. So I would like to ask a little poll, and the question for this poll is, please do tell us in what role you are primarily joining us today. So if my colleague Kate is, there you are, you should see the poll on your screen today. I recognise that several of you are juggling various roles, including parenting, but just tell us the primary one that is triggering your interest today, and let's take a look. So at the moment, really lots of nutritionists and health professionals, lots of people from council and local government, quite a few parents. Thank you for joining us. We've got midwives and health visitors, charities and NGOs. We've got some marketing brand professionals, academic researchers. We've got some food retailers and manufacturers. Thank you very much for joining this conversation today as well. So that's a really nice, diverse mix of people today. So thank you all for joining us. And it's great to have so many professional people, so many people who are directly engaged in this sector. We've got a wonderful panel of speakers lined up for today. I want to move the slide. I'm sure many of us watched Panorama last Monday or following that. It featured, so let's share those results. So there we are. So if we can take the panel, the poll down so that we can see. I'm sure many of you watched Panorama last week. It featured many of today's panelists. That programme focused specifically on baby pouches, but it raised issues that are common to a much wider variety of products aimed at early years in terms of the nutritional composition, marketing, packaging, health claims, as well as raising questions about how those products compare to home-prepared food. So that wider review of a broader range of products is brilliantly shared today by our two main speakers in their work on the report Commercial Baby Foods in Crisis. And whilst many of those concerns are not new, there has been very little spotlight on early years feeding in various previous iterations of child obesity policies and food strategy. Meanwhile, we've seen an upsurge in the marketplace, including the rise of new forms of packaging such as pouches, appearance of growing up and toddler milks, a whole range of baby snacking products, and none of which really existed when the current regulations governing infant foods were adopted in 2003. We've also seen these issues raised. Our own parent ambassador panel, when we established that last year, when we were building our manifesto for change, it came through very clearly how concerned many of our parents felt, how confused they felt about the nutritional content and the labelling of many of these products. And some of our parents expressed feelings of anger, frustration, as they delved deeper into those issues and started to see where the regulations do and don't apply. We've also seen market and promotional claims and pricing issues around infant formula come under scrutiny from the Competitions and Market Authority recently, with a set of really strong recommendations to ensure parents are not being exploited and misled. So things are beginning to change. So this research is incredibly timely, with the government also committing to the healthiest ever generation of children and starting to look at policy. So let's have one more question before we move to Ali and Diane, and that's, in terms of the current regulations governing the commercial baby food sector, how far do you personally, joining us today, believe that laws and standards governing commercial baby and toddler foods are adequate at the moment? So let's get a sense of the feeling in the room today about whether you feel they're adequate. So it's looking, and I'm sure that is largely due to the networks that Sustain and our partner organisations have, and also the number of health professionals in the room. But there's a strong level of disagreement with that statement. So broadly speaking, people in the room are saying, let's take another look at the regulations as they apply to the UK. So with that, I'm going to now pass over to our key speakers for today, Dr. Diane Threppleton and Ali Morpeth from the University of Leeds, to share their insights on their research of the commercial baby food sector. So I think my colleague Kate is going to post their CVs in the chat right now. But Diane is a specialist in maternal and early years nutrition. She holds the position of Senior Research Fellow at the University of Leeds and has worked extensively for the WHO, including on the WHO Nutrient and Promotion Profile model. Ali is also a registered public health nutritionist, but also working at the intersection of human and planetary health. And one of her roles is as a visiting researcher at the University of Leeds, consulting on projects around nutritional quality of foods and public health. So these are our two co-authors of the report alongside Professor Janet Cade. So over to you, Diane and Ali. Thank you.
Thanks, Barbara. Just check I can change slides. Thank you. And thanks also to Sustain for kindly hosting this webinar today, where Ali and I will talk through our new research on commercial baby foods in the UK, addressing issues around health, marketing and inequalities.
We just want to give you a quick snapshot of the work that we've been doing in this space. And actually, Diane and I have been working on this for an incredibly long time. So we started off in 2018, working in collaboration with the World Health Organization in Europe. And the first stage of that work focused on developing and also validating the nutrient and promotion profile model, which is what we call the NPPM. And that's now internationally recognized. Some of the visitors on the call might be familiar with the UK NPM, which is the model that many of us use to classify foods which are high in fat, salt and sugar. And the NPPM, the model that we've worked on, is similar in its principle, but it's tailored specifically to foods for infants and young children. So most recently, for the last 12 months, we've been applying this model to the UK market and using it to assess the current range of commercial baby foods to understand where improvements need to be made. Just to cover off for a second, why baby foods and why now? I think Barbara said in the introduction that the marketplace is growing, and that's really true. The commercial baby food sector plays a really powerful role in shaping dietary habits from early on in life, but many products are falling short of public health standards, both when it comes to the nutritional composition, but also the way in which those foods are marketed. So now is a really crucial moment because the baby food marketplace is growing rapidly. But unlike other food categories, it's not covered by HFSS regulations. So this really makes it a blind spot in UK public health policy. And we know from our work in this space that parents want clearer information and better options. We've got growing evidence and momentum for change. So now is a really critical moment to intervene with policy that supports young children's nutritional needs.
So what did we know before we started this work? Well, we already knew that baby food regulations in the UK are outdated and actually quite weak. So there are no limits around the total levels of sugar in baby foods or whether sugars can be added to baby foods. We also already know that frequent use of inappropriate products like those that are high in sugar will contribute towards overweight, dental decay, and sets kids up for lifelong preferences for sweet foods. There's also well-documented evidence of misleading or persuasive marketing practices used on baby foods. And this is known as the health halo effect, where product packaging or marketing portray products as being healthier than they are. We know that parents perceive that baby foods are well-regulated and healthy. And in fact, the government's advisory group says that commercial baby foods are not needed to achieve good nutrition. We also know the market is dominated by high sugar purees, snack foods, products that promote weaning too early, and generally purees that are quite poor in quality. So there are a range of known problems, and that's why the World Health Organization commissioned the NPPM. So it was published in 2022 as a way to support appropriate promotion of food products for infants and young children under 36 months, under 3 years. So I'm going to refer to these as baby foods from now on. So the tool is the first nutrient profile model in the world to also feature promotional or marketing and packaging guidelines along with the nutritional guidelines. And that's because they're seen as being so important to the way baby foods are marketed and sold. The NPPM recommends things like having no added sugar in baby foods, having only low sugar snacks, having a front of pack high sugar indicator to tell parents that, something is high in sugar. And also the NPPM recommends that product marketing is free from persuasive or misleading claims.
So before we get into the kind of detail of what our research has shown, we just wanted to take a second to show you the methodology that we have taken in doing this big piece of research. So first of all, we used the NPPM, so the World Health Organization model, to objectively assess the nutritional quality and marketing sold in 5 major UK retailers, which you can see listed on the left-hand side. And the reason that that is important is that it's allowed us to compare products against international health standards and understand how well the UK market aligns with the World Health Organization recommendations for children under 3. And then really importantly, we've also engaged over 1,000 parents through a UK-wide survey and also through focus groups. And that's allowed us to understand how families are experiencing the baby food market and crucially what support they want. So what did we find? Well, the offer in the baby food aisle that we found was 632 products in our total sample. So that's a big number. Overall, we found that meals were by far the largest category of foods in our research, and that was followed by fruit-based products. So many of those are sold in pouches, and also a wide range of snack foods. I'm sure lots of people in the call will be familiar that pouches have received loads of attention recently, and we really welcome that. But our findings also show that concerns about inappropriate nutritional composition go far beyond pouches, and we found problems across the entire baby food aisle, including products that weren't featured in Panorama. So this highlights the need for a whole market response in policy rather than being limited just to pouches.
So there were many concerning findings identified by looking at this broad sample of over 600 products. And as Ali mentioned, some of these have been well documented recently online, particularly in relation to pouches. But what we also saw is that across the whole sample of products, a quarter would require a front of pack high sugar indicator according to the WHO standards. We also found that misleading or inappropriate marketing claims is common. In fact, we found this on all products we looked at, including 19% of products with misleading names. So these are things often where the fruit content or the primary ingredient, the main ingredient, is not obvious from the product name. So we've seen products that are 97% fruit being marketed as if it's a porridge or a yogurt or a baby rice, or something that's made primarily with apple being named a strawberry snack or a strawberry food. For meals, we found that 41% are too sweet. So the NPPM recommends that meals should not be more than 15% sugar, but we found 41% of meals actually were too high in sugar. And at the same time, 21% of products in this category were too watery, so they're not providing enough nutrition at this critical development time. Also, we found that more than half of snacks contain added sugars. So Ali and I will now focus on some key category issues, some category spotlights, and we've got some product examples to illustrate what we're talking about here. So for confectionery, we're not seeing chocolates in the baby food aisle, but we're seeing a growing number of sweet gums or leathers made from concentrated or dehydrated fruit that are marketed towards babies and toddlers. And these actually have quite high sugar levels. So the World Health Organization stipulates that products like these are not suitable for children under 3. We found 21 products that we classified as being confectionery according to this World Health Organization standard. And on average, these products were getting 2/3 of their calories, 2/3 of their energy was coming from sugar. So the example here is Raspberry Crispy Tiddlers. So this product, 3/4 of the calories in the product comes from sugar, and yet it's marketed as being one of your 5 a day. It's great for little ones learning to self-feed, and it contains no artificial additives. When we looked at snacks, The World Health Organization recommends no more than 50 calories per serving, so quite a small serving size, and a maximum of 15% energy from sugar, meaning that snacks should be essentially savoury or not too sweet. Across the sample of snacks we saw that a third of snacks were overly sweet, exceeding this 15% threshold stipulated by the World Health Organization. And as I mentioned, over half of the snacks contain added sugars. So often this is concentrated fruit juice. Sometimes it's in the form of sort of regular sugar, but sometimes more often it's concentrated juice that's used to sweeten products. So when you look on the ingredients list, you don't see that the product contains sugar. These rusks, these Farley's Rusk biscuits, in this product, 28% of the calories are coming from sugar, and it does contain added sugar. So sugar is the second ingredient listed on the pack, and yet it's marketed as a great finger food, a nutritious snack, and an ideal weaning food for your baby.
So the other category spotlight that we've got here is fruit products. And just to say that the World Health Organization stipulates that any product which is ready to eat and has more than 5% fruit is classified by WHO as a fruit product. In our research, we found that 9 out of 10 fruit products would have a front of pack indicator on them, according to WHO, for being high in sugar. But at the same time, and it can sound a bit confusing, many of these products are low in essential nutrients like fat and protein, and they're often quite watery. So that means that according to international guidance, they do not provide the energy or the nutrition that young children need to grow and thrive. We've got some product examples there on the slide, and the pouch shows that they might have marketing claims like immune support or 2 of your 5 a day, while equally having a high proportion of their energy coming from sugars and also be watery, so they're low in energy. Across the slides, we hope we've shown some examples of product categories and how those categories are marketed, but we just wanted to flag that it's also really important to recognise that marketing practices cut across the entire baby food aisle. They are not limited to specific categories. And we found in our survey and through talking to parents that marketing really strongly influences parental decision making, sometimes in ways that is a direct conflict with public health advice. So, for example, by suggesting early introduction of foods before 6 months. And we also saw marketing that normalises snacking behaviours from a very young age, which can set up long-term patterns that are not aligned with healthy eating habits.
So to touch on issues of health inequalities in this work, we did look at how product price related to quality, and we saw that the price was significantly related to quality in our statistical analysis, in that lower priced products tended to be lower in quality. And this was a trend seen across the data sample. So when we looked at all pouches, the ones at the top end for sugar were also cheaper in price. And when we looked across all snacks, the ones at the top end for sugar, again, were cheaper in price. And these findings on price and sugar presented on this slide and further data presented in our reports indicate that families who are shopping on a budget and are seeking out cheaper baby foods are more likely to take home products with poor nutritional profiles and that are marketed in less responsible ways.
So hopefully that context has given us a kind of deep dive on the data, but we also just really want to flag what parents have been telling us through this phase of work, because it's been a really important part of the project to engage with parents to get their understanding of how they are engaging with commercial foods. And overall, we found that snacks and ready-to-eat fruit products are used incredibly frequently. So 2/3 of parents are offering snacks either daily or several times a week, and 68% of parents are using fruit products just as often. 40% of parents with babies under 6 months are using ready-to-eat fruit products daily, so really frequently. And 1 in 5 parents also told us that they're still using those products daily by the time their child reaches the age of 2. So that highlights to us how embedded these products are. Over half of parents told us willingly that they struggle to identify healthier options based on packaging. And it really demonstrated how hard it is for families to make informed choices around feeding their young babies and children. We really struggled to pull out the quotes for this slide because we've got so many insights through the work that we've done with parents, but we just wanted to flag some of the parents' voices throughout this phase of the research, and you can read some of the quotes directly from parents on the slide. Overall, there's kind of 3 key points. So number 1 is that parents are really concerned about high sugar and misleading marketing. They consistently voiced their alarm over high levels of sugar in baby foods, and they were really frustrated with packaging and claims like suitable from 4 months, which can falsely signal kind of nutritional quality and suitability for young children. They also told us that there's strong support for regulation and clearer labelling. The majority of parents across all backgrounds that we engage with supported the front of pack indicator for high sugar products, and they agreed with enforcing a minimum weaning age of 6 months on pack. And then the last point, I think we said it in the slide earlier, is that there's a huge amount of frustration and confusion around navigating this marketplace. Over half of the parents that we surveyed found it really challenging to identify healthier options based on on-pack information.
So I'm just going to go into one of the points that Ali just raised in a little bit more detail. So we found that parents do support policy change. So the survey of 1,000 parents, I've mentioned the front of pack recommendations in the NPPM before, and these are designed, the front of pack high sugar warning label is designed to help parents make informed choices, steering parents away from too frequent use or large servings of sugary products. So when we asked parents about this in our survey, we found that more than 7 in 10 parents agree with having a front of pack indicator, a front of pack warning for high sugar products. They want transparency. And we also found that 63% of parents in the sample we surveyed agree with having a minimum age standard of 6 months. And when we looked across the whole sample at the different parent subgroups, so we looked at parents differing by age of children, household income, deprivation category, ethnicity, and across the 4 UK nations, we found that these sentiments were universal. Parents universally supported policy change. In our reports, we've outlined a series of recommendations based on those from the World Health Organization, and our recommendations are for the sectors that have a role to play in making changes, so policymakers, retailers, manufacturers and brands, and we urge you all to read our reports and recommendations in full. In brief, we're recommending regulation for products marketed to children under 3, so that's strong mandatory standards for composition and marketing. To enable this, we need to adopt a standard nutrient profile model. The NPPM was developed over several years and in fact validated with data from the UK, so it's a ready-made tool to enable this. Also, we feel it's important to integrate infant foods into the government's food strategy, recognising that poor diet at this critical development time for children can have lifelong negative impacts.
We also know that retailers and brands have a role to play in this. So our recommendations for retail is to prioritise healthier products on shelf by aligning them with the NPPM, restricting the promotions of inappropriate products, and restricting listings of products which are not age appropriate. And then the last one is do not situate baby foods in promotional bays. So although baby foods are outside of the HFSS regs, products which don't meet WHO guidance shouldn't be situated in high traffic areas which were previously given over to HFSS. And for manufacturers, uphold the NHS and WHO recommendations to introduce foods from 6 months, support goals to reduce sugar intake, improve quality and support taste development as well in the early years. making sure that first foods are more veg and savoury flavours and are nutrient dense, and avoiding excess pureeing and increasing textures is really, really important for infant development. And then a couple of last ones to clean up on-pack and online messaging to avoid misleading or persuasive claims that parents have highlighted as a key issue, and to include a statement on products to protect and support breastfeeding.
So just to wrap up, our evidence demonstrates that commercial baby food use is widespread and the quality of these products is just not good enough. There's a real gap between what we know is nutritionally good food and what parents expect, and what's on offer on the shelf. And we think there's a fantastic opportunity for the UK to lead the way in improving infant nutrition through regulatory change. And as Ali mentioned, there's a serious role for retail and manufacturers to play in taking positive actions to make improvements as well. We really strongly believe that parents shouldn't have a hard time feeding their babies healthy foods, and that it's the wider food system that should be the thing to change. But we recognise that parents might want some help now to navigate the market, and we've prepared a brief information sheet with some tips for parents, and I'll share a link to this on the next slide. And clearly today our focus has been on commercial foods and how things can be improved, and many parents do rely on commercial products, but I think it's important to recognise, where commercial products sit in the wider context. And as a researcher invested in improving diets, I think we need to consider more broadly how we can support normalisation of simple, healthy foods and home prepared meals for babies and children. Thanks very much, and I'd like to thank our funders, Which and Sustain, for making this research possible. If anybody wants to read more or find our reports, you can access them by taking a picture of this QR code.
Thank you so much, Ali and Diane, for all your painstaking analysis of this commercial baby food product sector. We've had loads of questions coming in while you've been talking, and some of them I think we're going to keep for later for our main panel. We've got lots of questions coming in about weaning advice and how we communicate with parents, and I think our broader panel would love to come in on that. I wanted to just quickly check, there's been a couple of questions about the difference between fruit purees and free sugars as they appear in things like baby pouches, and free sugars when fruits are being boiled or pureed at home, and whether, are there references to the difference in free sugars? And also there's been questions around the fructose levels and how much fructose should be in children's diets. And I don't know if either of you want to say a couple of words on either of those questions around this concept of free sugars and the difference between home cooked and commercial foods.
Thanks, Barbara. I'll answer the question about fructose first, as that's on top of my head. I don't think that there is any specific evidence, or we have no information about the fructose levels in these different products. It's not published on the back of pack. In terms of the sugar question, and I guess the question is to do with free sugars and whether it's whether free sugars are different in table sugar and pureed foods. The NPPM classifies them as being synonymous, especially when products are pureed, because the cell walls have been broken open and sugars have been liberated. So liberated is the word used in the NPPM documentation to describe these particular sugars that have been released during processing. Okay,
so there's no kind of scientific references that show that fruit purees sold are contributing more to free sugars than if people boiled and pureed fruits at home.
Oh,
with or without sugar.
A difference in commercial foods compared to home foods. There may be citations, I don't have them to hand.
We'll have a look for you afterwards. Okay, thank you.
Just one other build on that, Barbara. If people are interested, there is also a sugar fact sheet that we've put together on the NPPM site, which breaks down where the implementation of the front of pack indicator sits across product categories, because it is so confusing. So the WHO has tried to make it simple for parents and caregivers by indicating where that indicator would apply to high sugar products.
Great. Okay, that's good. I've got lots of other questions, but I think we're going to move on for now. And I think it's important at this stage that we start to hear a parent perspective on this topic. And I want to introduce next Mary Needham-Carlton, who is a parent ambassador for the Children's Food Campaign at Sustain and the mother of 5-year-old William, but she's also a registered nutritionist specialising in public health nutrition and a co-founder of Munch CIC. So Mary is one of the group of parents that helped develop our parent manifesto and looked into some of these issues. So I'd like to, so Mary, as a parent, you know, it feels like a real minefield out there. And Ali and Diane's research really lays bare some of those challenges for parents when they're in the baby food aisle. So do you want to say something about your own experience of trying to navigate that personally, but also what do you think parents like you and parents like the ones that you're working with need from both companies themselves and from policymakers?
Yeah, hello everybody. Well, we didn't use pouches when my son was a baby, but where we really struggled was with snacks, because he started to become a bit of a fussy eater, and for convenience, really, we found ourselves in the baby food aisle. And you know, it's really you know, as a nutritionist, obviously I know that these products can be high in sugar, but it's really hard, and inevitably my son would always want the products that I was trying to avoid, particularly if they had a Gruffalo or something like that on them. So yeah, and no, it's really hard word to kind of find in these moments, because we're sleep deprived, we're juggling lots of other responsibilities. And to be honest, I find the baby food aisle itself really overwhelming. It's really sensory. There's loads of colors, there's loads of images everywhere. It can be really confusing. And you just kind of want to just get something quickly and go. So, it's really difficult. But I think for many parents as well, and particularly the parents that I work with, cooking baby food or food for children, or any food really from scratch, is also really, really overwhelming, because they just don't feel like they kind of have the capability to do that. They don't feel like they have the skills. They don't feel like they can provide the organic, fresh, nutritionally balanced food in what they're going to make. And there's also the worry that their children will reject it and it will be wasted, which they just simply can't afford for that to happen. So for a lot of these parents that I work with, they just simply feel that it's quicker and safer and easier to buy baby food from processed baby food. And also they do assume that the products are healthy, because we see the food producers as an authority, and as parents they trust them, we trust them basically. So I think policymakers need to tighten and enforce regulation around the levels of nutrition that baby foods contain, and make it mandatory to display like clear, easy to understand front of pack labeling, so that parents can make an informed choice around what they buy. And also I think there needs to be a lot more public health messaging for parents around weaning and around age appropriate foods and nutrition. And I think that policymakers should do more to equip parents with the skills and the knowledge and the confidence that they need to cook from scratch. I think as parents, we should feel confident to cook for our children, and we should also feel that we don't have to wander into the baby food aisle wondering which products are going to be the least damaging for our kids. I think we should be able to be confident that all the products are well regulated, and that the policymakers and that the food producers are on our side.
Thanks, Mary. That's really, really important that, in all of this, none of this is about kind of trying to make life kind of parents feel bad about the choices they're making, but trying to make sure that the landscape in which they're looking at the options available, that is trustworthy and informational, and that people access that information. And on that point, I'd like to bring in Charlotte Sterling Reid now, because Charlotte is an award-winning nutrition consultant and a best-selling author of the book How to Wean Your Baby. And so she's completely dedicated to trying to provide information to parents in clear and reassuring ways, and works both individually and with parents on courses. So Charlotte, you know, in terms of the advice given to parents, and how can we reassure parents that actually, you know, getting that balance right between what you prepare from scratch at home and how, and what advice are you giving about how much to use these types of products, and how to navigate some of these complexities given the issues that Ali and Diane have raised?
Yeah. And, you know, I think that part of what I do is trying to reassure parents in a lot of the work I do, and in the conversations I've been having in the last couple of weeks. It's about reassuring parents, first of all, that this is not about shaming you. This is not about making you feel guilty. Parenting is incredibly hard, so we're not trying to add extra pressure on. This is actually really about industry and government and trying to make changes. So just as Mary just said, and I thought that was such an important point that she made, which is when you go to the supermarket aisle, you're not bamboozled with a load of products that you can't interpret as to whether that is healthy or not. And a lot of the messages that are coming out from parents is, I don't know what to do now. And I think that's a real shame. And that in the UK in 2020, you know, in the year that we're in right now, we should not be having parents who are feeling confused about this. The work that I do is all about parental confidence. It's about giving parents confidence to know how, what, when, where to feed their babies and their toddlers. And actually what we need to do as a kind of UK-wide policy is to help give that to parents a lot more. I think there's a lot of issues that we have at the moment. So, for example, from an environmental perspective, we've already heard about what's available at the supermarkets. A lot of these aren't developmentally appropriate for young babies and toddlers. So I wholeheartedly agree that we do need more regulation. I wholeheartedly agree that we actually also need to make sure that the products that are available are developmentally appropriate for babies and toddlers, that they contain textures, that they are low in sugar, that they encourage a lot of the public health messages that we have around weaning. There's other environmental problems though. So for example, parents, we know so much how important the first 1,000 days of life is. There's a lot of research on the fact that early childhood matters. It matters in terms of the patterns of eating that are developed. It also matters in terms of the long-term health of young children and families. So actually, why is there such little support for parents around this time? When parents start weaning, there is no advice. There is very, very little in the way of healthcare professional support and advice. And that is often given can be misleading, out of date, or confusing. Health visitors aren't necessarily trained in this area. And I actually saw a parent yesterday who'd been told at an antenatal class that weaning was ideally to be started at around 3 months of age. So in her mind, she was thinking that she was going to start weaning her baby at around 3 months. And unless there is advice from government or more intervention that comes out and is a bit more widespread, universal, less conflicting, really specific, we're going to have a lot of parents who are very, very confused. And the third thing I would add to that is that I feel like the environment in terms of where we take our babies, the baby groups, the nursery that we send them to, the play areas, they are full of foods that are, again, not necessarily developmentally appropriate for young babies and toddlers. So parents are learning their entirety of them having their babies and toddlers. All of these foods that they see around them are what is becoming the norm. So from my perspective, it's about raising parental confidence. We need to make sure parents know it is cheaper, it can be really easy, and also getting babies having the same foods they are having as adults too, but just slightly adapted. We need to get parents confidence. We need to get government to maybe have some tighter regulations so that brands can have a level playing field to work off. And we also need to improve the environment, the wider environment where parents are feeding their babies and toddlers. And I feel really strongly about that. I hope that helps to answer your question.
Yeah, thanks, Charlotte. And I'm glad you picked up that piece about early weaning. We've had some questions in the chat about that. Yeah. And the fact that we know that some of the brands who have been putting 4 months plus labels on their products have now committed to changing those to 6 months. But the way in which that 6 month guidance is being undermined, but also the need to keep reinforcing that you can keep feeding your baby breast milk or milk substitutes for longer than 6 months. You don't kind of have to make this kind of like massive overnight transition, and that raises a whole load of other issues about the infant formula industry as well, which somebody else has raised. So let's bring in Vicky now, because I think whilst we all agree that the landscape for parents, it needs to have better support, this cannot just be down to parent choices in the midst of a market making free with all sorts of information that's not regulated. So Vicky, First Steps Nutrition, you've been flagging for years now that there's been a bit of a policy blind spot, which extends to the baby food aisle in our supermarkets. Why do you think this has not been the focus of attention now, and what needs to change?
Yeah, I mean, it's $1 million question, isn't it? It does feel like our government isn't really prioritizing early years nutrition, isn't really prioritizing babies. So to set the scene on the regulations and the guidelines, I think a fundamental problem is that the regulations governing the commercial baby and toddler food offer are 22 years old. So they predate the invention of baby food pouches and the vast array of baby snack foods. And they're really inadequate. So for example, they do place limits on pesticide levels, the presence of certain substances like sweeteners. They do give minimum and maximum levels for certain nutrients, and they do give some labeling requirements, for example, the need to show ingredients. But, and this is Ali flagged this earlier, there are no maximum levels of sugar, no set maximum levels for total or added sugar. The labeling requirements allow the labeling of use from 4 months. They don't stipulate what the composition of the baby food should be, and they don't include specific provisions on marketing. So when companies say that they comply with the law, it doesn't really mean anything, because the law is basically not fit for purpose. Just to give, so we've had these really, really old regulations. In 2020, a year after Public Health England published their evidence review, they consulted on draft voluntary guidelines for industry to improve the composition, and they promised a separate consultation on marketing and labelling. But that consultation came and went and nothing happened until very late 2023, when OHID picked up these draft guidelines, and they undertook a closed consultation with stakeholders. Our understanding is that we had improved voluntary guidelines ready to be published last spring, but the announcement of the general election got in the way of anything happening. So we are unfortunately in a situation where we're still living with 22-year-old regulations, and we have no clear idea from the government on what they want to do next. And in fact, their response to the Panorama investigation and the wording defending the regulations sadly seems to suggest they're not going to do anything. So that seems to be where we are in terms of what needs to happen. Several panelists, and Ali and Diane have mentioned this, couldn't agree more. The bottom line is babies can't wait. We've seen the dire state of the current retail offer exposed by Diane and Ali's research, and our public health stats on obesity and dental health show that there's a massive problem. So we really need our government to live up to its promises to give all babies the best start in life and raise the healthiest generation of children ever. We might have been content with voluntary guidelines a year or two ago, but we know voluntary measures don't work. So it's high time for stronger mandatory regulations using this ready-made tool, the nutrient promotion and profile model from WHO Europe, and making sure that we have updated regulations that also are in line with public health recommendations. And that's what parents need. They need to be able to, if they're going to go down the baby food aisle, if they want to use these products, that at least they know they're going to align with public health recommendations, notwithstanding that, as has been made really clear, they shouldn't be everyday foods. We ideally want parents to be enabled to be cooking healthy home prepared foods at home. But the baby food aisle is not going to go away. We need the offer to be improved. so that the composition is more appropriate and so that parents can make informed choices if they're going to buy these products.
Thanks, Vicky. And, you know, I think that is a disappointing response from the government at the current stage. We know that there's people working hard behind the scenes. Some of them may even be sitting in this call today. And so, you know, I hope that message around the support within this webinar, but also the support more broadly around a need to take a stronger look at the regulations. And if anyone is wanting to support us in that, it's Sustain. Sustain particularly has launched an e-action, which you can send to your MPs. I'll ask my colleague Kate to put the link to that in the chat. If you want to get your MP to raise this issue, if you are concerned about kind of showing that broadly we want to see those regulations looked at and not just and to go beyond the voluntary guidance, I think please do take a look at our e-action and send that to our MPs. We need all the help we can get. I'm going to bring the rest of the panel back in now and we'll start taking some of your questions. We've touched on some of them live already in the conversation. So let's start with, there's been a question here that's been given quite a lot of votes, which is, why aren't healthy snacks freely available in cafes, restaurants and leisure? And what needs to happen on that? So many meal deals include so many sugary products and sweets and crisps. So, and even more difficult, says the questioner, if your child has allergies. Anybody want to take that one?
I'll go. Yeah, I am often really shocked by what's on offer at the you know, places for parents to go with their young children. I think it's obviously a commercial thing. Having access to freely available fruits and veg just doesn't, you know, necessarily help anybody profit from that. So I think that is definitely one side of things. I think for me the problem becomes where these become really habitual, and I know from my own experience with 2 young children that when you go to these playgroups, other mums see other mums giving their babies these snack foods and they feel like this is the place to go. Quite literally last week when the whole Panorama program came out, I had one mum say to me that she knew that parents start their babies weaning and the first thing they do is go to the baby aisle to get the information, to get the foods that they need. So it's almost like a given that that is where we are heading. And I think it becomes habitual, and I think parents see other parents doing it. And exactly like we've spoken about on this call today, it's almost an assumption that the food is going to be developmentally appropriate. It's going to be nutritionally appropriate. And obviously, as we know, that isn't the case. I would love to see healthy food heralded a lot more, but unfortunately at the moment, I just don't think that will happen unless somebody is profiting from that. But, you know, I'd love to hear from others on the panel. Vicky, perhaps.
Yeah. Does anybody else want to come in on that? Thanks, Charlotte, for putting your camera on.
I guess I've just got to add to that, Barbara, which is these things are massively prolific, and I'm also a mum of 3 kids, so I see these things all the time, but there's nothing to stop the NPPM being implemented in other settings. And so, for example, if you're a retailer with a cafe in your store, you can still apply the NPPM to work out whether a product is suitable for something like a children's lunchbox. So I don't have the answer as to why they're prolific, but I would just kind of reaffirm the point that the NPPM is a ready-made tool to assess the nutritional composition of children's foods, and it could equally be applied to other settings.
Yeah.
Thank you. Let's move on. Let's just go back to this weaning guidance question. And somebody has put the point that weaning guidance has changed over the years between 4 and 6 months. And some of that movement towards kind of saying weaning from 6 months seems to be around trying to encourage exclusive breastfeeding for the first 6 months. But then there's also some other evidence about introducing novel textures and flavors a little bit earlier than that, and that advice is confusing. How do parents, nutritionists, policymakers get behind the WHO guidance to understand what is appropriate for the UK? And also, Ali and Diane, I'm particularly keen to hear, have any other countries adopted the WHO guidance on the NPPM? So maybe I'll start with you, Ali and Diane, about this kind of weaning guidance. And then also, can we pick up on the WHO NPPM and where it's gaining traction.
Thanks, Barbara. Regarding the weaning guidance and the WHO's 6-month recommendation, I'm not aware that any other country has formally adopted it into regulation, but I know that other countries are going in that direction. And actually, the WHO recommendation is in line with NHS recommendations, which are to start weaning or introducing foods around 6 months of age. So I've been working with academics and public health professionals across the globe, so across Southeast Asia, in Australia and several European countries, and they're moving forward with applying the NPPM to their own baby food products on sale to see, how do the baby foods on sale in their different countries match up with these international standards, and they're using the NPPM as a lever for policy change. So there are, I know there are different, I know that there's progress being made using the NPPM, and it'd be great if we can see that progress in the UK as well, because the NPPM, the World Health Organization standards, have a lot to offer, even if they're locally adapted. There are many things in the recommendations that do make sense for baby foods.
Thanks, Diane. Do any of the other panelists want to pick up the question around this 4-6 months weaning and the appropriate time? Vicky, I'm looking at you.
Yeah.
Yes, thank you.
I mean, it's a very, very, very long time since it was recommended to introduce solids at 4 months in the UK. It's not new, the public health guidance. And it was changed as evidence, has grown, and the benefits of exclusive breastfeeding have been realised. I don't know of evidence that suggests that there's benefit to introducing foods in terms of, I think the question talked about texture and flavour before 4 months. Yeah, the NHS recommendations are to introduce solids from around 6 months when the baby shows signs of developmental readiness. And that is in line with the WHO global recommendation that for all babies everywhere in the world.
Thanks. We've just got a couple of minutes left. I wanted to just ask you a kind of a slightly controversial question. Do you think there's any products or current formats of products that simply should not be in the baby aisle at all? Is there anything that should be moved, or any types of products that you think simply actually maybe shouldn't exist? And I just, I think it would just be fascinating just to hear your personal views.
I'm happy to jump in with a response to that, Barbara, and say that it's important to note that in the UK, our advisory committee on nutrition does state that these products are not needed. So I think that's a good starting point. And then also referring to the international best practice guidance, we also know that snack products are particularly problematic and they are not recommended for children under 3. So I think that's kind of where I would go with an answer to that.
Okay. What about you, Charlotte? Is there anything you'd like to see disappear altogether?
I would definitely agree with the baby snacks. I think that, again, we're encouraging habits from a very young age that are not appropriate for adults, let alone young babies. I really don't see a need for baby snack products. They are, nutrient deficient largely. They contain empty calories. They're not adding, the whole point in snacks, which should be for +1 only, is that they should be offering energy and nutrients to a baby's diet to complement their meals. And these snacks are not doing that. So I definitely completely agree that there just isn't really a need for them.
Thanks, Charlotte. What about you, Mary?
Yeah, I agree with snacks as well, because as I said earlier, we really struggle with those. And although we always try to choose the healthy ones with, oats and things, I really think that my son kind of got addicted to them really quickly, and when we did withdraw them, which we didn't use them for that long, it was there were a lot of tantrums and it was really hard. So yeah, so I think I think everything really, but that's not realistic. So yeah, snacks as well, I think, probably.
Thanks, Mary. I'm afraid we're coming to the end of our time, but I want to just give Vicky one final word, Diane one final word, because you didn't get the snacks question. So, and then we'll wrap up. So Vicky, final thoughts, your final thoughts for everybody on this webinar based on.
I'm speaking to attendees from DHSC with a plea to do the right thing, to make strengthening the baby food regulations in line with WHO's recommendations and our own public health recommendations a priority. I want to say this could make us a leader in Europe, and it's essential if our government want to live up to their election promises, and our babies and toddlers can't wait and they deserve it.
Thank you. And Diane, a final word from you.
Thanks, Barbara. I'd just like to reiterate that this is original research, but it's not a new problem. We've known these issues for over a decade, and the snail's pace of change in baby foods is not only extremely frustrating, but I think it's placing the future health and development of our children at risk. Real change is long overdue. And as I mentioned, stakeholders in Asia, Australia, and across Europe are making waves with MPPM. Let's not drag our heels, but I think we could be global leaders in placing children's nutrition first.
Thank you. I think that's a great note on which to end this webinar. Let's make, but this government wants to create the healthiest generation of children. So let's become global leaders in this sector. I think that's a great vision. It's been a fascinating discussion. I'm sorry we didn't quite get to all of your questions. We will take a look at those, and where we think there's some topics, we will see whether we can add some more information to the follow-up information that you'll receive. I'm conscious there are many perspectives out there on this that we haven't managed to cover, including the brands and retailers and the government officials and the early years nurseries, that I'm sure there's plenty of room for more debate going forward. So let's keep up that constructive dialogue between all of us, and let's make sure when we're doing that, we're putting the health and well-being of our babies and toddlers at the centre, and the empowerment of parents to cook food from home, cook food from scratch at home, and get the right nutritional information. Please do take 2 minutes if you can. If you do agree that you think there needs to be more regulation, more regulatory clarity around this sector, please do take a moment to take a look at our e-action. The link is on the screen and in the chat. We'd love to hear your feedback on this webinar. You'll see a link being put into the chat. It will be sent to you following this event. Please do take just 1 or 2 minutes to help us improve the quality of our events. I'd like to finish by thanking our brilliant speakers, particularly Diane and Ali, for their amazing work on this and for a fascinating hour, and also for all of you of our panelists for all of the work you're doing to put the spotlight on the healthy feeding of our youngest children. Thank you again to Which for supporting the research, to Impact on Urban Health for supporting Children's Food Campaign and our parent work. And thank you personally to my colleagues, Kate and Naima, who've been busy making sure this webinar is working behind the scenes. And finally, thank you to all of you for taking an hour to join us today and for keeping up this debate as we move forward. Have a really good rest of day, and thank you.